You all must have heard about this revolutionary technique, the RIBX, for remodeling. And I've been talking about this the entire week. And I think it's time for me to give you all the details of the rib remodeling procedure. Who is it for? Who should not do it? What is the procedure like? What is the recovery like? What are the contraindications, etc., etc., etc. And I think it is important that everyone who wants to get that Barbie waist needs to now start considering the RIBX technique for their rib remodeling. So here we go. Now, this technique was started, in fact, invented by Dr. Raul Manzaneda, who is my teacher, who I went down to Paris to learn from. And following this, we are now going to be doing for the first time in India the RIBX technique. And what does this promise you? Anybody who wants a beautiful hourglass figure with a Barbie waist. Now, what is Barbie waist and how is it different from the normal hourglass? The hourglass techniques that we've been doing all along has involved liposuction to reduce the waist at the abdomen level. So we reduce the waist here, add some fat on the hip dip region, add some fat on the buttock region, and that is the hourglass figure. But now we have gone a step forward. What do? We create that curve right up till the waist level. So the lower bone cage, also called as the rib cage, is brought in. So the curvature gets further enhanced with the rib remodeling procedure. As the word indicates, rib remodeling. It's not fracture, it's not taking out the older techniques. You might be scared where they used to take up the ribs out, bizarre procedures, but rib remodeling. We are giving a new shape to the rib with minimally invasive scarless procedure. Rib X scar, no scar. So using a specialized technique, we are working on the ribs which are responsible for widening the bone cage here and just modifying their direction to take them inwards and enhance the Barbie curve and the abdomen and chest to an extent that if the patient follows good post-operative protocols, they can lose up to 15 centimeters of waist and get a beautiful Barbie shape. So 15 centimeters means 6 inches. Just imagine how much of a beautiful curvature you can actually get. Most patients will lose up to about 10 centimeters, that is about 4 inches, and some who follow very stringent post-operative protocols can end up losing almost 6 inches from their waist. And then we do the fat injection over the hip dips and the buttocks, and you get a very nice hourglass figure. So who's a candidate for this? Anybody who wants a super fine hourglass figure. So they can be women who are already very conscious of their body. They can be transgenders who've done procedures of feminization, but because they have a masculine chest, they want to reduce the ribs and get more feminine. So these are the two kinds of people who can undergo these procedures. These procedures are not for men because rib remodeling creates an hourglass figure, and men obviously don't want that feminine look. So men not allowed. Important thing is anybody who wants to undergo these procedures cannot be a smoker. If you are a smoker, stop for 3 months. Otherwise, this can be very bad. Healing will not happen. You will have prolonged pain, etc. You cannot be a fat person. You cannot have too much of visceral fat, that is fat inside the abdomen. It has to be very, very low. You need not be athletic. That's not important, but you need to have a reasonably petite figure in order to get the best result. If you have some amount of fat in the abdomen, the result will not be so much, because then the hourglass figure might not show. The full 6 inches effect might not be so much visible, but still, it will still show anything from 2 to 4 inches of decrease. So anybody who has a lung condition like COPD, like asthma, is not a candidate for this. Any heart disease is not a candidate. Any other major medical problem is not a candidate. So you've got to be medically super fit in order to undergo these procedures. Before doing this procedure, we do some tests which are mandatory. Cardiac evaluation, then we need to do a pulmonary function test, and we need to do a bone study if you are above 35 years of age. And lastly, the most important, we have got to do a 3D CT scan reconstruction to show the ribs, where all are the attachments, how is the rib shape, which is the widest rib. All that can be judged on a 3D CT scan reconstruction of the rib cage. And once we have that, we then decide what all are the ribs that need to be remodeled. Most commonly, it is the 12th, 11th, and 10th rib which is remodeled, but very, very frequently, it is the ninth, 10th, 11th, 12th that need to be done, because sometimes the ninth one is actually the widest rib, and by remodeling the ninth one, you can actually get a beautiful hourglass figure. Cut to the surgery part. Now, once everything is clear from the anesthesia point of view, the surgery itself takes less than an hour. That's done under anesthesia, and the procedure just involves making very fine scoring marks with a very, very fine needle, and then using a specialized technique, we model the rib using our thumbs, and the patient is immediately brought out of anesthesia, and she goes home within 3 to 4 hours with a pressure bandage around their waist and the abdomen, and the patient needs to wear that for 3 months. There's a certain protocol to it. It involves gradual tightening of the pressure garment so that the ribs are continuously pushed inside. That gives the final effect. They can get back to office after a week, but please remember, no sports and no exercising for at least 3 months. Please remember, heavy contact sports or traveling in crowded areas needs to be avoided for at least 6 months. Stuff like taekwondo or judo or football need to be stopped for at least 6 months. Otherwise, you might have a problem in bone healing. Otherwise, recovery is super quick, back to normal action within a week. Post-operatively, do we expect problems? No. These procedures are generally absolutely safe. Till date, 5,000 odd procedures have been done worldwide, and only 2 incidences of bleeding inside the rib area has been noted, and they were because of the patient fell down after a month for unrelated reasons. And there have been 4 cases where there has been some air which has collected around the area of the ribs, and it has been easily treated. So that's not a problem. My team will be with you all the time to manage your post-operative period and to watch for any signs of problems. So these are very, very, very safe procedures. You can expect a complete result in about 3 months' time, and we will be having regular follow-up visits. And if you're not from India, then know that you have to be with us for at least 10 days before you start traveling. And traveling has to be, you have to be very careful. You cannot lift heavy bags, and you have to avoid jostling around with other people. So a lot of care might be needed during travel. So that's pretty much what the rib remodeling technique is. Why RIBX scar and why not the conventional? 80% less pain, super fast recovery, no scars. If you like scars, go for the older technique. If you don't like scars, then you follow the RIBX, and we will make sure you get a beautiful Barbie shape.